Buenos dias, and I want to thank the Society and Dr. Aceves for having me here today. I spoke to you last year in Zacatecas. I'm sorry to say my Spanish has not improved over the last year, so I apologize for having to present to you in English today. I am Michael Hartney, and I am the lawyer for Surgical Review Corporation as well as for ASMBS. And in that capacity, back in 2002, 2003, I helped ASMBS decide how they were going to do their Center of Excellence program. And now with Surgical Review Corporation, I'm heavily involved not only in the ASMBS program, but also in the program that we are now administering for your society. We administer a program for Brazil, for India, and we have our own international program. So Dr. Aceves asked me to talk a little bit about why your society is doing the program and some of the details. And so I don't forget at the end, I have some information with me today. If you see me at the end of the presentation throughout the afternoon, I can give you what I have. It's all in Spanish. If you give me a business card, I will have one of our support people who speak Spanish call you next week, or your coordinator, to give you whatever information we can. So let's talk first of all about why we want to do a COE program. Well, first of all, you want to do it for your patients. We know that mortality is low in bariatric surgery. I'm going to have some stats on that later on, but we do know that improvements in morbidity and complications are possible. There's still actually a lack of consensus on what works best for which patients. Through our BOLDS database, we're attempting to address those issues. Best practices have been established, but they're not clear-cut across the board. What we like to say with our centers that are in a Center of Excellence program, they are committed to using best practices. Those that aren't in a Center of Excellence, we want to get them into the center so that we can all start working off of a level playing field. And what's also key for all of this for patients is by participating in your society's program, ultimately you'll be participating in our BOLD database, which now has over 400,000 patients in it, and ultimately we'll be able to answer some of the basic questions about bariatric surgery. You want to do a COE program also for yourselves and for your hospitals, and you want to improve outcomes, you want to lower costs, and you want to increase volume, and all those put together is going to better your bottom line for both you and your hospital. You have some healthcare changes coming in your country. We have some huge ones coming in the United States. We don't know what they're going to look like yet. But the one thing that across the board, governmental agencies, your health ministry, private payers are asking for data. And again, by participating in our program, you will be contributing to what is now the world's largest database for bariatric surgery. We think it's important that the top performing surgeons and centers be recognized. You get that through a COE program. We want your society to make a name for itself in the world in bariatric surgery. And again, that'll be one of the things that happens as we get your program launched off the ground. So let me talk now about some of the goals and some of the fundamental principles behind what we are looking at and what we talked to your society leadership about when we were putting the program together. First and foremost, I think we all would agree that patient safety and advocacy is really our number one priority. It's your priority, it's our priority at Surgical Review Corporation. And again, we believe that by participating in a Center of Excellence, you can tell your patients, your hospitals, the people that you work with, that you are consistently practicing and achieving best practices. Again, the Central Outcomes Database, which is BOLD, is extremely important. In the U.S., and we hope to include Mexico and our international surgeons as we move along, we are now being approached to participate in clinical trials through the FDA because our database is so large. That presents a great opportunity for you as COE surgeons to participate in those programs also. And again, you know, your payer system in Mexico is a little bit different than the US, but there are some payer issues. We have a strategic alliances person whose main job is to talk to payers. She has actually talked to some of the payers here in Mexico, talked to your health ministry about issues facing you and bariatric surgery. That comes with being part of our program. And that bottom line, I think, is really important. As I said, we're doing a program not just for your society now, but also for Brazil, for India, and surgeons in other countries that don't have a society program. What we're trying to do is create a network with you and our surgeons in the US so that if you have a patient coming from the US, you can operate on here, and then if that patient gets referred back to a COE surgeon in the US, we all know that there's a good continuum of care for that patient. So the more surgeons that we can point to in Mexico is saying they've met the standards, they're a center of excellence, that's going to really broaden your patient base. And again, in the end, the patients will be well served, and I think better served for that. These are some questions I'm going to go through quickly, and you don't need to raise your hand, but just think of these. And I suspect all of you are going to be able to say yes to these. If you think that we can improve morbidity, there's always room on improving or at least lowering complications. If you believe that results improve with experience, the data collection in and of itself, there have been some papers presented on that the mere fact that you enter data into a database means your results get better. Interesting concept. If you think it's correct that a hospital should have a medical director for bariatric surgery for that specialty, not somebody who's also worried about other surgical techniques or procedures. If you think that your call coverage, a surgeon who steps in for you when you're away or a meeting like this should have at least experience in bariatric surgery. If you think that's important, that you think it's important that a hospital maintain either an ACLS or an equivalent certified specialist who can resuscitate a patient in an emergency if needed. And certainly that, you know, you think it's important that facilities have the proper equipment to deal with the obese and the super obese patient. When we started this program in the United States, the equipment issue was a real issue. People were operating on bariatric patients with sub-sized, smaller operating tables, scales, and part of the process is making sure you have the equipment that you need and you can get your hospital to get for you to properly operate on these patients. If you believe that best practices for bariatric surgery should be established and followed, that specialized training for your support staff, your integrated health people, your physician assistants, nurse practitioners is important, that patient education and support is important, and if you're committed to long-term follow-up of your patients and submission of your data to the BOLD database, then I submit, then you are ready to apply to your program. Because if you thought all of those things were important and you could have raised your hand to all of those things, those are basically your requirements. And there's no reason you can't apply now to your program. This isn't an overwhelming or impossible process. It's in place right now. I'm going to go through real quick some of the concepts that we vetted with your society leadership. The first part is that we ask for three entities, yourselves as surgeons, you link to your hospital where you do your cases. Your practice is really your office, wherever it is that your home base is. We think that's very important. It's been proven in our American program in Brazil that this three-way application is extremely important, because you, in a way, are only as good as the hospital facilities and the support your hospital provides for you. And if that's lacking, becoming a center of excellence gives you some argument and some force with your hospital to get those resources that you need to fulfill all of our requirements. The application process, if you go to our website, and I've got some notes at the end, surgicalreview.org, we have a specific page now dedicated to your program. It's in Spanish. It explains the entire process. Once you register and apply, the application is all online. It's all electronic. There are two parts. You fill out all the questions, and you will probably most immediately be told that you meet the requirements for provisional status or provisional designation. This is like the first step. Depending on how you answered the questions, it may say you actually also, at least on paper, meet the requirements for full approval, full designation as a center of excellence, and that you're now ready for a site inspection. When you are ready for a site inspection, you'll be notified in advance. We have site inspection materials that have all been translated into Spanish, so your staff will be able to easily go through them. We tell you exactly what you should expect during the site inspection. The site inspection is performed in order to basically make sure what you said in your application is actually in existence. We also do a review of your procedures and your charts. The important thing to remember here, because we've gotten just in the last few weeks some questions from some of you at our office in Raleigh. If you go through a site inspection and we note a deficiency, say, you know, you don't quite meet this requirement, we tell you that in writing. We let you know exactly what it is that we need. You have every opportunity. We work with you to make sure that if there was a deficiency, you can correct it and meet it. Oftentimes, especially when we first launched the American program, centers would come through, but once they got through our site inspection, we noted, you know, you're missing this, you're missing that. They didn't automatically pass the first time. Virtually every one of those centers, after we worked with them, was ultimately able to achieve the full approval designation. So if you go through the site inspection, it's not a one shot and you're out. We work with you, we tell you exactly what's missing. Sometimes it's just documentation that we need, and that can be a matter of days or weeks. Other times maybe you need to have a few more support group meetings and document that. But once that's done, that denial turns into an approval. So we work with you. The site inspection is rigorous. I don't want to discount that, but we note for your benefit what the issue was, what you need to do to correct it, and we will help you do that so that you can ultimately meet the requirements for full approval. It's really important, if you listen to what I'm saying this afternoon or this morning, if you think that you're maybe not quite 100% on the requirements, but you can meet most of them right now, and maybe with a little work meet more of them, get online and look at that application and apply now for provisional status. Even if you don't automatically qualify for that site inspection, again, our staff will work with you and tell you what you need to do specifically before you qualify for the site inspection. There's no need to wait. We have a support staff in Raleigh. We have a native Spanish speaker that can walk you or your staff through whatever issue comes up. And our goal is really to try to help you and your hospitals understand what needs to be done in order to move forward with the process. These are basically the requirements that your society leadership agreed to. I'll note that these are essentially exactly the same as the American program, exactly the same as Brazil and India. 50 cases a year for the surgeon, that's less than one a week, 125 over your lifetime. We do recognize a certain number of fellowship cases if you did cases in your fellowship. You have to have a designated medical director for bariatric surgery. You have to have a covering surgeon that's experienced in bariatric surgery. You do have to be a member in good standing of your society. Let me correct one issue that we also get questions on. You do not need to be American boarded. In the U.S. program, you do. In your program, you do not. The one requirement is that you be a member in good standing of your society. So if you're not American boarded, it does not prevent you from applying and becoming a COE of your society's program. You do need to have standardized orders and clinical pathways. That's actually an issue. That's still an issue with our American facilities. We work with you. Those of you who belong or at least go to ASMBS meetings may have been to a COE course that we put on every year there. Clinical pathways is a big part of that because people are unclear what exactly we're looking for. But again, if you're unclear, we will help you. We have templates that you can use. We don't dictate what you need to do. We just want to make sure you're telling us exactly what you do in the routine case. You have to have procedures in place for a goal of 75% follow-up over 5 years. Now that's a goal. That's not a requirement that you be able to follow up all those patients for 5 years, but you need to have something in place so you can follow up a patient. BOLD database helps you do that. And you also agree that you will ultimately report your data to our database. The institution requirements, your hospital has to perform 125 bariatric surgeries in a year. It does not all have to be by you as a COE surgeon. Other bariatric surgeons can contribute to that number. You do have to have ACLS or equivalent qualified, somebody cardiac qualified to deal with the patient that goes into arrest. You have to have standard equipment. This is another issue that our support center can help you on. Don't be telling your hospital you have to automatically go out and suddenly buy a bunch of equipment without checking with us. We'll tell you exactly what we're looking for. We basically want to make sure that you have the equipment that's appropriate to operate on the patients for whatever size they are. If you operate on high BMI patients, you should have appropriate equipment. If you don't operate on the highest BMI patients, your equipment doesn't have to be the biggest and the best. You do also have to have organized support groups. So as I said, this is your society's program. Your society's leadership has set the requirements. What Surgical Review Corporation does is simply administer the program. Your applications come to us. We have a system where they get reviewed through a panel of international bariatric surgeons. The site inspections are done by us. We administer it, but we don't set the requirements. Those are by you. Surgical Review Corporation, sometimes we get asked this. It's a nonprofit corporation, which in the U.S. means there are no owners, no shareholders. I don't have stock in the company. Our CEO doesn't have stock. All the money that comes in goes back into all the programs and that make them operate. We have a board of directors, which is comprised of various stakeholders from the health industry. Dr. Neil Hutcher, who many of you know, just retired as a surgeon in Virginia. He is chairman of our board. He is also our chief medical officer now. We have an attorney on our board who's heavily involved in healthcare issues for surgeons and hospitals. We have a chief medical officer of one of the largest American insurance companies now on our board, and it's been really interesting to hear his insight on bariatric surgery. He's a big supporter. So the people governing the company, again, they're really you and the people that you use in your practice, because our focus is on healthcare, bariatric surgery, and some of the other specialties that we're now into. As I said, your program is governed by your society, so if there's ever going to be a change in requirements, that comes from you. We just follow orders. We don't tell you what you have to do. Your society is saying this is what we want it to be. We have a number of committees. As I said, we have an international bariatric surgery review committee with surgeons from outside the U.S. on. that kind of oversee the entire international program. We have several committees that deal with our database, which is, I'm going to have some statistics on that in a moment. I think at one point in the last few months, we have over 100 outside people, mostly surgeons like you, working with us on various committees. So it's not just a few people in Raleigh, North Carolina, wherever that is, making these decisions. It's people just like you that are making them for us. As I said, we are simply a subcontractor to your society. We carry out whatever orders your society gives us. We provide strategic alliance support. That's basically talking to payers, talking to your Ministry of Health, and again, the big thing that we offer is our database. Speaking of which, BOLD is our bariatric outcomes longitudinal database. Just a few facts about BOLD. Once you become BOLD activated, this is a real-time data entry database. You enter information on patients at 5 different stages during the patient encounter, pre-op, peri-op, post-op, and any follow-up that comes along. We have patient encounter sheets that are now being translated into Spanish so that your staff or you or your staff can fill out, and then whoever the data processor is can input that data. We're trying to make it as easy as possible with this transition to non-native English speaking countries, so that to make it easy as possible for you and your staff to use what we've got set up. A couple important points. SRC, Surgical Review Corporation, does not claim to own your data. You own your data. You sign some documents that gives us a license to use it for research purposes and for monitoring compliance with the program. The great thing that we do, I think right now, we offer surgeons at least 15 different types of reports that you can get online, log into your BOLD account, and we have 15 different reports that you can click on and automatically download. You don't have to ask us, you just do this. More of those are coming out all the time, so you can compare yourself to your colleagues. We're going to be able to make it so that you can compare yourself to surgeons in the U.S. and other countries. The idea is that we want to be able to give you information that's helpful. And just along those lines, BOLD has been out since about 2007. This fall, I can't get specific on a date, but sometime this fall we're coming out with version 2 of BOLD, which, although I never thought BOLD was all that complicated, it's actually simpler now, the new one coming out. So by the time all of you apply to your program and get BOLD activated, you'll be using an even more streamlined database, even easier user interface than there was before, although as I said, once people start to use it, they see how easy it is, and now since we're able to get these reports out, hopefully it's more useful for you. And as I said, we have a number of committees that oversee the questions that get asked of BOLD and how the data is going to be used. So our standard fee structure is this. These are US dollars. Surgeons always pay just $500. You pay $500 when you apply, and it's $500 a year after that. The hospital pays $7,500 for the first year when they first apply, and then it's $3,975 after that. Now, a number of you should have been getting emails from Surgical Review about special pricing that we had the last couple months. I just talked to Dr. Aceves, and I let him know for your society, for your program, we have continued that special rate for your hospitals. So if your hospital applies to the program before the end of July, we're giving a discount, continuing a discount of $4,975. We're not doing that for your colleagues in Brazil or India or elsewhere, so please don't mention that to them. But we are doing it for you. So if you think that you can get your hospital signed up and paid by the end of July, they will get that special pricing. Just some statistics to let you know what your becoming involved in when you become Mexican Society COE. Right now, around the world, we've got 650 hospitals and freestanding outpatient centers in our program. That's nearly 1,100 surgeons, and that's 22 countries. And again, we're doing a program for you, for Brazil, for India societies, but we also have a program for surgeons outside of those countries whose society hasn't yet decided they want to do it on a society basis. So we have surgeons in Asia and Europe and throughout South America now who are also in the program. Actually, one figure where I said nearly 400,000 patients are now enrolled. When I was at the ASMBS meeting in Orlando a couple weeks ago, I got an email. We are now over 400,000 patients enrolled. Patients are being entered now at the rate of 12,000 a week. There was a paper presented at ASMBS on BOLD data. I can tell you a rough count is there 5 to 7 papers now being written, all using BOLD data. And those papers are not coming just from Surgical Review Corporation, but they're coming from surgeons as yourselves who have submitted data requests and proposals for papers that have been approved, and that's they're being worked on right now. And so we still have over 1,100 surgeons and 650 facilities that are actually using BOLD. Just real quick, this was one of the first papers on BOLD. The 2006 figures was from a paper presented at ASMBS in 2007 that looked at complication and mortality rates from our applications only, just what people said on their applications. And then a few years later, we did the first data mine from BOLD. So this was actually outcomes data that had been put into the database, and we could show a decrease in hospital mortality to 0.05%, 30-day mortality 0.09%, and as you can see, 90-day mortality down to 0.11%. This chart shows, it's from another paper. This is Dr. Hutcher's practice in Virginia. He retired in November, so he's no longer a practicing surgeon, but he, as I said, he's our chairman of the board, and he would, if he were here, what he would tell you is he was always a supporter of the COE program. He was president of ASMBS when they decided to do the program, but he always thought, you know, it's not really going to do anything for me. It might be good for my marketing. But when he looked at his own figures, look at this. Before he was a COE, he had complication rate of about 11%. A few years after, it was down to 3%. Reoperations dropped from almost 6% to 1%. His readmissions from almost 10% down to 3%. And the last couple years that he was a surgeon, he had no 30-day mortality. And he would say it's not that his skills necessarily got better, but it was the process of making sure everybody on the team came together, was doing the same thing every time, that across the board resulted in their outcomes showing a pretty drastic improvement. Just real quickly, these are your two currently, or should say 3 currently designated COE surgeons, Dr. Herrera from Mexico City and Dr. Ortiz and Dr. Gamboa from Tijuana. They originally applied through our international program before your program was authorized, but what we've agreed with your society is that anybody that comes in either through our international program, it will become an automatic Mexican Society COE and vice versa. So if you're a Mexican COE, you'll also be one of our international COEs. Next steps, what can you guys do? If you see me here today, grab me. I've got some information in Spanish I can give you. If nothing else, if you give me a business card, next week I will have our person in Raleigh contact you or whoever you tell me to get you started on the process. This is just some information. Again, if you just get on our website, you can navigate through it. You'll see the pages that are dedicated solely to your program. They're in Spanish. If you call that number, you'll get our Spanish-speaking support person to answer your questions. Her name is Alejandra. A number of you have met her. She's wonderful. And if nothing else, send us an email and we'll get back to you. So I thank you for your support. Thank you for inviting me here today. I live in San Diego, and as I come down the coast, I always forget how beautiful northern Baja is. So I hope you have a good meeting. Thank you very much.